Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I specialize in minimal invasive facial rejuvenation. I develop many techniques for facial rejuvenation. Today I'm going to talk about the difference between the conventional resective blepharoplasty versus the technique I develop. This is the conventional resective blepharoplasty of the upper eyelid, and this is the lower eyelid. The result of this technique is a big resection not only of the upper eyelid, also the eyebrow skin with this long scar. This is a patient who was operated in the United States. As you can see the scar, the resection of the upper eyelid and the eyebrow skin. But I'm concerned the results and the complication of this resective conventional blepharoplasty. For me, this technique is not to adapt to the modern times, because with laser today we do not need to damage the skin, to resect the skin, and to get these terrible scars and complication. You can see the complication, the scars, and the lack of thalamus and ectropion. And in 1994 I began to perform a technique that I perform stab incision in the upper eyelid and the tightening the skin with carbon dioxide laser. And this is the way that I remove the upper eyelid fat pads, and this is the tightening with carbon dioxide laser. Here we can see that I'm able to resect all the upper and lower eyelid fat pads without leaving any scar, and improving the quality and rejuvenate the skin of the upper eyelid, lower eyelid, periorbital area, and other areas of the face using technique, and this is the result. As you can see, it is impossible to rejuvenate this skin with the resection of the skin here, strip here, and also it's impossible to improve all these wrinkles, removing a thin strip of this area. But this is the result: no scar, skin rejuvenation instead of skin damage. It is impossible to obtain a true and lasting facial rejuvenation if the surgeon do not use carbon dioxide laser. And this is the result: a complete periorbital rejuvenation without skin. You can see with the closing eye how improved the quality and tightening the skin of the upper and lower eyelid. My legacy to the science is the skin tightening and rejuvenation instead of skin resection. Many plastic surgeons around the world that read my publication come to Argentina to learn about this technique, and I think in the future we spread all over the world this new concept, this new technique that is revolutionary in the area of facial rejuvenation. I think synergy is the sum of the procedures to generate better result. And when the patient comes to look for a blepharoplasty, they also have photo damage in the other areas of the face, and it is very important for the patient to rejuvenate other areas of the face in order to get a natural, good-looking result, but with a full face, because we do not aging in just in some area. It's a complex process, and this is the result. And it's important of the volumination of the cheek area, the reposition of the eyebrow. And also I developed a new technique, a minimal invasive procedure to reposition of the forehead and the eyebrow. And this is the result. Getting this, the orbital frame is very important, reposition of the eyebrow, fulfill the cheek area, and this is the result. you can see it is impossible to rejuvenate all this area removing a thin strip. Carbon dioxide laser is the magic wand to eliminate facial wrinkles, as this is a patient was operated with a conventional technique. They produce an ectropion, they left all the wrinkles, they pull down the eyebrow, and this is what I can do with the reposition of the eyebrow, the improvement of the wrinkles, but the patient do not want to improve this, because for treat this ectropion is another procedure that the patient do not want to perform. And this is 8 weeks after the procedure. You can see how improved the wrinkles and other cases. To get rid of facial wrinkles, get a truly facial rejuvenation, and the patient can for facelift or eyebrow. They also need improve another areas of the facial, and this is all with my technique. This is nearly 2000. There is not good writing. The future of periorbital rejuvenation will not longer be the resection of the skin, will be rather the rejuvenation of the skin. I hope to have encourage another medical doctor to perform this kind of procedure. If you live outside of the country, you can send me pictures. And I'm going to evaluate what do you need, and you can come to Argentina to perform directly this procedure. You are not need to stay longer in Buenos Aires, because this procedure have a quickly recovery. Have a nice day.